Do you see how well this fits underneath the jowls? Welcome, my name is Daisy, and today I'm going to tell you why you should be microneedling your jowl area, your lower half of your area, lower half of your face area like yesterday, okay? I've been working in microneedling devices for over 13 years, creating my own microneedling patented products. And now that I'm closer to 40 than I am to my 20s, and I'm closer to 50s than I am to my 20s, it is important to take care of this lower area of my face. Okay, so I'm going to be explaining a little bit about my story, what jowls are, why collagen loss matters, how microneedling can help jowls, professional versus at-home microneedling, why Banish is designed for jowls, how to demo this, how to do this safely, and who should not microneedle. So you guys know that I've created my company Banish back in 2012, and I've created so many different devices for microneedling products because I really wanted to create safe, affordable, at-home microneedling products. And the reason why I started my business was because I've had really bad acne scarring, okay? And the only way to treat acne scars, because acne scar is a loss of collagen in the skin, right? It's a very particular, very small area, but there's a lot of loss in collagen because of the deep cystic acne that I got. You have to do everything in your power to try to rebuild that collagen up and like smooth out that skin. So microneedling has been the best thing for collagen loss that you can do at home, right? Microneedling with a vitamin C serum. So I've been doing microneedling for over 13 years. And you know, through the 13 years of working on Banish, I have won a lot of different accolades, you know, Forbes 30 under 30 in manufacturing, Inc. 500. I did a TEDx talk, had a cool billboard. But now that I'm closer to 50 than I am to 20, I have to start thinking about the lower half of my face. Also, when you get older, your fat starts moving around. I know, it's like, do we want the fat? Yes, we do want the fat, but we only want fat in certain areas and not others. Well, guess what? The fat moves where you don't want it to move. So when you're young, you have a lot of fat in the cheek area, right? You have a lot of volume in the face. As you get older, that fat kind of droops down and gravity takes over. So you get a lot of jowling in that area. So you get a little bit of change after 20 years old. Definitely during rapid weight gain, the jowling can start occurring, but definitely there's a big cliff when it comes during perimenopause and menopause, right? The skin structure changes. So what can you do at home to help treat jowling? Well, you can help with the skin firmness. You can help with the fine lines. You can help with early jawline softness. But however, at home, you cannot reposition your fat pads and you cannot change the structure of your face. I know, I wish. That you would have to see a plastic surgeon. And if I were to give any advice on getting professional services done, just make sure you seek multiple opinions, because you definitely want to go with someone you trust and someone who is not going to give you a botched job. Okay, but the reason why I love microneedling and why I do not stop talking about it is because there's so much clinical data and research about microneedling. For example, microneedling, it's also called percutaneous collagen induction therapy. So when you microneedle, it actually releases a growth hormone protein called TGF-beta3, and that triggers collagen production in where you prick that tiny channel into the skin. Okay, so why should you have started microneedling yesterday for your jowls? And when I say microneedle yesterday for your jowls, look how easy it is to fit the Banisher underneath the jawline, the chin area, right under this kind of section. Well, there is so many studies about how microneedling has helped thicken the skin. Okay, and I love talking about this, and this is why I do so many videos about it, because I always find so many new studies proving that microneedling really helps thicken the skin. For example, in the article, Microneedling Advances in Widening Horizons, it says that new collagen after microneedling continues to be laid down for 3 to 6 months after treatment, leading to lasting improvements in skin thickness. So here in this image, the skin is literally thicker. You can see here, there's more purple. They stained it purple. the collagen, it is literally thicker, right? So what you can do at home is you can treat the laxity of the skin in terms of the jawline, right? That is not in your control. That is in your control. It's like the serenity prayer, right? God gave me the courage to change the things I can control and the wisdom to know the difference, something like that, right? So we can control the laxity in the skin. So how does it work? Like, how does microneedling actually build collagen in the skin? So when you microneedle, your skin goes through 4 different phases, okay? 4 different phases and changes. It goes through homeostasis, inflammation, proliferation, and remodeling. So when you prick your skin with the tiny gold-plated needles from the Banisher, basically growth factor hormones are released, specifically one called TG beta 3. And this is really important because what you want to do is you want to create scar tissue, because that is the way collagen is formed, but you don't want to create any further scarring. You don't want to create any visible scarring. And this is the most important thing, if you don't take anything from this, is that when you microneedle, you want to make sure you are triggering that production and you are using a topical serum that directly affects collagen production, but you do not want it to create further scarring, because if you're like me, I will scar over everything. Everything in my life has left a scar. I just got a new cystic zit right here. It's left a scar. So you want to make sure that you're not creating further scarring by microneedling. I have gotten professional microneedling done. They use the Dr. Pen device. And for me, it was way too traumatic. The needles on the Dr. Pen were way too thick. It created further scar tissue, which is visible if you look closely. I have scarring at the nasolabial lines from doing that. So you definitely want to be careful of the device you're using. Okay, but that TG beta 3 is really good because it promotes that collagen production without leaving traces of that scar tissue. And then you have inflammation phase. So this is where the new tissue formation starts happening, the blood flow starts happening. So right after you microneedle, like a few hours after you microneedle, you do notice that the area you microneedle is like a little bit red, you look a little bit sunburned. That's good. It's good. It's that inflammation state where the body is like, okay, something's happening. Okay, like skin, start repairing, like get your horses ready and check, right? It starts like signaling to your body to repair itself. Then is the proliferation stage, which happens 2 days to a few weeks post-treatment. So fibroblast cells responsible for collagen and elastin production are activated, and new skin cells called keratinocytes proliferate, leading to epidermal thickening. And a type 3 collagen, which is a softer form of collagen, is deposited in the dermis. And then up to 6 months post-treatment, type 3 collagen is replaced by type 1 collagen, which is stronger and more durable. So that is so cool how the body just naturally like gives you a new form of collagen after you microneedled. Like it's like getting new shoes, right? Getting a new fit, getting like new hair and new weave. I don't know, but it is really cool to know that your body actually has a stronger form of collagen after you microneedle, and this happens for months after your microneedling treatment. So this is why I say you should have done this yesterday. Like, let's go back in time. We should have done this 10 years ago, okay? And the extracellular matrix is rebuilt, enhancing skin texture, firmness, and hydration, okay? So microneedling for jowls. Remember, it works by strengthening the skin. A lot of data for this, but it will not help with your bone structure, okay? So there's also another study in the safety and effectiveness of microneedling device in improving signs of aging skin by Glynis Albon, published in the Journal of Clinical Aesthetic Dermatology in 2018. It says that 48 patients, subjects aged 35 to 75 with signs of facial aging were recruited after consenting and satisfying inclusion criteria. Each subject underwent 4 microneedling sessions 30 days apart. And the conclusion of the study said that the 4 microneedling treatments of facial skin significantly improves lines, wrinkles, skin laxity, textures. Side effects were minor. So yes, it does help with fine lines and skin texture. And also, I learned a new word when preparing for this video. It's called peroeorrhitides, and peroeorrhitides are the smoker lines, okay? Not that I'm a smoker, but they've done studies where you microneedle right here, okay, it does help. Peroeorrhitides does help with these smoker lines. So in this study by Alster and Graham, they show this image, peroeorrhitides after 3 microneedling sessions without other treatment modalities, and the smoker lines, definitely you can see a huge improvement in that. And it basically says that microneedling has been proven effective, the treatment of facial rhytides in multiple publications. It significant increases in collagen type 1, 3, and 7, as well as elevated levels of tropoelastin were reported. The amount of dermal collagen was shown to increase with cumulative treatment. The reorganization of existing collagen fibers and simultaneously increased production of new structural dermal components after microneedling is believed to be responsible for observed skin tightening. Okay, so so there's just so many good studies about how microneedling has helped peroneal rhytides. And also in the article by Singh and Asham, Microneedling Advances and Widening Horizons, Indian Dermatology Online Journal, from July to August 2016, it says that, again, a significant increase in levels of collagen type 1, 3, and 7, newly synthesized collagen tropoelastin were observed, and they saw that skin was more elastic, more collagen, and the effects are enhanced when procedure is combined with a topical anti-aging vitamin C serum. So this is why in every single Banish kit, we include an L-ascorbic vitamin C serum. Okay, so before I get into the demo, I'm going to explain why you need to use the Banish serum right after microneedling, okay? And I don't include it because I want to increase more clutter in the world and more unnecessary skincare products. Everything that I include in the products is based on science. If I wanted to include a product to be used after microneedling, I want some heavy duty shit, okay? Like, I'm not gonna have something that is like fun, it's like soothing for the skin, blah, blah, blah. Like, I want something that's gonna go into those channels that you just made with this bad boy, and I want it to stimulate that collagen, and I want there to be a lot of data behind it. So L-ascorbic acid is the most clinically studied form of vitamin C, and the reason why I include the Banish serum is because the molecular structure of L-ascorbic acid, there's an OH factor to it. I took organic chemistry a million years ago, so it's getting a little rusty, but it adds an OH to proline and lysine, which are the building blocks of the collagen helix. It's like muscles to protein as collagen is to L-ascorbic acid. That's why we include it. And there's studies because in the Abla, Barbul, proline precursors and collagen synthesis, biochemical challenges of nutrient supplementation and wound healing, published in 2017. Do you want me to read this? I'll just put it right here if you want to read it, and I'll put the link if you really want to have some nighttime reading. Yeah, like nighttime fun reading. If your Valium is not helping you sleep, you can read that article. But basically, collagen synthesis needs the hydroxylation of proline, lysine, ferrous iron, and vitamin C. Deficiency in some of these factors lead to impaired wound healing. So I'm not having no impaired wound healing. I'm having paired wound healing. I'm having the wound healing be wound healing, okay? So this is why I say after microneedling, you need to use a vitamin C serum. Okay, so let's talk about how we're going to use this bad boy and why this is so well designed for microneedling the jowls area. Like, you guys, I created this device, okay? She is all mine. I'm going to tell you why ergonomically this is the best for microneedling your jowls and why you should have been microneedling your jowls yesterday. Okay, so what you're going to do is you're going to clean the Banisher. I am wearing foundation. I'm going to be honest. I am wearing makeup, like obviously these lashes. Maybe I'll insert a clip of me without makeup doing this, but all you're going to do is you're going to microneedle the peroneal rhytides, okay? And you guys can see the nasolabials or nasolabialing. So what I like to do, and don't make fun of me, this is a safe place, I blow like a fish. Have you guys seen Dory, Finding Nemo? Okay, and then when you microneedle, you need to microneedle along the sides of the jawline, okay? And then you also need to microneedle underneath. Do you see how well this fits underneath the jowls? So with other microneedling devices, you can't microneedle there. With the derma rollers, you can't microneedle. Like, you're gonna get stuck, okay? You can't do that. You're gonna hurt yourself. With the mechanical devices, I don't really know how you're gonna go under here, right? But with the stamper device and how it's shaped and how it's held and the weight, and the needles, it goes right into the jowl area. Now, people always ask me what size needle length should I use? 0.5, 0.5 here, 0.5 here, 0.5 here. If you want to be really aggressive and you have been using the Banisher for over a year and you're a loyal customer, diehard, you know what you're doing, you can change this head out for a 1.0 needle length. It's really easy. You just snap it right back on and microneedle here. Because this area, you do have more skin and more fat, so you can microneedle here. I would not recommend using a 1.0 unless you have ice pick scarring or you want to do it on the body. But if you do have a lot of fat and loose skin, you could try the 1.0, only if your skin can tolerate it, okay? And then you can see I have these necklace lines. So after you microneedle, you just want to gently, this is with the 0.5, okay? Do not use a 1.0 right on the neck. You can use it if you have like fat and loose skin here, okay, but not right on the neck, 0.5, because the skin on the neck is really, really thin. And you're going to just microneedle these necklace lines right off, okay? Again, microneedling the jawline. And make sure you go all the way, like from here, all the way to the side. Another big question I get when microneedling is, if I have a lot of loose skin or lines or wrinkles, what should I do? So it is totally okay to pull the skin, but you don't want to like snag the skin, right? Like lightly lift it. So you can see here I have, some gravity is working. Okay. You can gently lift the skin and microneedle and target. You can just see how easy it is to target areas along with the Banisher, right? So I created this device because I just think it's so important for people to know how hard to press and how to target. Now, you guys, it is so important when you microneedle, especially the jowl area, you need to be doing this consistently. This is not a one and done thing. And I think that's the biggest mistake people make is they'll do it once and then they're like, okay, I'm done. I need to see results. Your skin is the largest organ. It is living, it is breathing, it is degrading in terms of the collagen, right? Production, thickness. So you have to constantly be doing this. And people, the most frequently asked question I get is, how often should I do this? 0.5 needle length, I would say every other week. If you go more than that, your skin isn't going to take time to repair itself. Remember, your skin is rebuilding that collagen. That type 3 collagen is being replaced by type 1 collagen, and that takes time. It takes months. You don't want to overdo it. Okay, so then afterwards, you want to use your Banish vitamin C serum. It comes in every Banish kit. This is freshly made. It is the only clear vitamin C serum. Look how clear she is. Because I'm going to show you the older vitamin C serums, I believe. Like, she is yellow. Do you guys see? This one's yellow. This one's old. This is like 2 years old. And this one's clear. It is because we make all of our products fresh. So you're going to apply the vitamin C alongside the jowls. So you're going to apply it over the top, the sides, where you microneedled, right? You're going to microneedle here, along here, and then you're going to microneedle underneath. You're going to microneedle the necklace lines. You can go all the way down here. Now, the next question that people ask me is, how often should I replace it? And I say, you should replace it if you're doing this whole jowl area, the whole lower half of the face, no more than I would say 3 times. Okay. Technically, like our supplier, our manufacturer says that you should replace it every single time. You guys know that I don't think it's necessary. I think that you can clean it. And that's why in the Banisher you have a self-sanitizing cap. But at the same time, there's skin debris after every time you use it that you cannot get rid of. And with prolonged use, the needles can dull. There's higher risk of infection. So you do want to replace your needles. And because if you're going to microneedle the jowl area all the way down here, right? This area, it's a big surface area. It's bigger than your face, right? Because you're going underneath this jawline and underneath this chin area. So there is a lot more skin. So I would say like 2 to 3 times you need to replace the needle head. Okay. Why you need to use a manual stamper for microneedling? Because the jawline skin is thin and is very sensitive, especially in the neck area. Okay. So the manual stamping with the Banisher provides controlled pressure, precise placement, less tearing, and reduced irritation on the skin. And I highly, highly, highly do not recommend using motorized devices. There's a ton of reasons why I do not recommend using motorized devices, but as somebody who has permanent scarring from using them. They can drag the skin, they can create tearing in the skin. You can really tear the skin down, okay? You don't want to be using a motorized device and just like squiggling the skin everywhere. Just stamping is providing what you need for percutaneous collagen induction therapy. And I have not seen a single study out there saying that a motorized device is better for collagen induction therapy than a manual stamper device. I have not seen any studies out there. And so a lot of it to me just seems like it's cool to have something vibrate, but you know, you can use vibrating devices on other areas of your body. You don't have to just always use it on your face, you know, like not really necessary. So why the Banisher is ideal for at-home microneedling for jowls. And also the Banisher is really, really good for replacement, right? We sell replacement heads. They come out to less than $20 a head. And we also have a subscription service. So you do want to microneedle consistently to help tighten this area. Now, again, remember, it's not going to help the structure and it's not going to help the fat. It is going to help, though, tighten. Okay, so how about aftercare? So aftercare, definitely use a Banish vitamin C serum. Keep using that. Try to stay out of the sun the next day. If you must go out in the sun, use a mineral physical based sunscreen. Wear a hat. Try not to like go tanning the next day. Okay, so I hope that helped answer a little bit of questions about jowls. If you can, go back and buy a time machine and microneedle your jawline and your jowl area and your neckline. I wish I did it 10 years ago because I'll be honest, I have not done much microneedling along the lower half of my face because it was never really an issue for me until after I had my second baby. So I have been starting to microneedle my bottom half of my face, and hopefully I started microneedling the bottom half of my face, but I have been microneedling the temples of my face, which I swear is the reason why I don't have crow's feet. And I'm starting to also microneedle the nasolabial folds. But I always, you guys, I always had acne scars along my temples. So that's why I always microneedled there. And that's why I don't have crow's feet. But I never microneedled along the lower half of my face because that's not where I have my acne scarring. Yeah, it's another place to microneedle. But good thing I have a microneedling company. Good thing this is what I do for a living because I will never be without a microneedling tool. So it's just really, really important. You guys do it consistently. You microneedle consistently. You know, it literally only takes 5 minutes along these areas, but you just have to do it consistently. Okay. Here, all the way, and then all the way. All right. So thank you all so much for watching. I hope you guys learned something, and I will talk to you guys later. Bye.